Hello and welcome to Thinkermaker. In this episode we'll see how decades of destroyed morale has resulted in staff becoming chronically tired, numb, indifferent, robotic and stressed. Some, in fact many, British trained staff even hung up their uniforms and walked away from the NHS career altogether. And no wonder. Look at these headlines from our archive of the mid-90s health sector news. Staff demoralised, distressed, even suicides. And 20 years later, 2014-15, the same headlines, low morale, and this one even predicts a brain drain from the NHS. So not so different from 2020. Hey, this has been going on a long time and we can't just blame funding. Gordon Brown already tried throwing money at the problem, over 100 billion in 2007. But that didn't work. And big data, IT also failed. 11 billion wasted in 2011. And countless restructures, at least 7 in 24 years, about 1 every 3 years. And despite the restructures and showers of money and IT systems, no success. So what's really going on? Let's try to understand. The common factor throughout is that we've been pursuing an excessively rational, evidence-based metrics approach to care. For a quarter of a century. Evidence is worshipped. It's sacrosanct. But that's the problem. You see, health care is a business in which the client is a human who is also the product. Health outcomes depend more than anything else on human feel-good factor. Yet when it comes to attending emotions, which is central to caring and morale, science has no precision device to measure them, so they're not properly counted. Nor any of these things essential to care: listening, keeping dignity, developing trust, showing compassion, building hope, speaking sincerely, and morale. Being unmeasurable, these qualities get deprioritized, resulting in a very unloving, process-driven culture. So bit by bit, staff unconsciously come to reflect the new culture. In a metrics culture, if it's not measurable, it gets ignored. So the love go-round is over, because the love in caringness is not in the data. Although this grates against care workers' natural instinct, as the saying goes, if you can't beat them, join them. So staff naturally adapted by conforming with the new system and process-driven culture. Many have become numb, robotic, and even Jobsworth. Their sense of loving purpose got challenged with indifference. In recent years, it's been known for health staff to say heartless things like, "You'll never be able to work again," leaving patients feeling dejected and written off. Hardly caring. Can you measure this feeling? No, it's not in the data. Unmeasurable things like compassion got deprioritized in a target's culture. Imagine if we made compassion a target. How would you measure it? Kilograms? I don't think so. Science has no device to detect compassion. But imagine paying nurses £500 for 500 kilos of compassion per week instead of an hourly wage. Just because it can't be measured, that does not justify ignoring it to be left undervalued outside the bottom line driven system. And look where we've got to. Now, when mistakes happen, NHS management, in all their wisdom, are turning apologies into a systematic and process-driven task. Apologies must be prompt. Why? Well, 2 reasons. First, promptness is measurable. It's time. They can make it a target. Secondly, studies show that apologies can reduce negligence claims. So following rational logic, managers try to make apologies systematic. What utter foolishness. They disregard the most important factor, authenticity. A prompt apology is good, but authenticity is more important to human spirit. But it's not measurable. Look, management have even published an apology protocol for staff. Ridiculous, it even fails to mention the essential eye contact. The human mind is sophisticated, an emotion detector, and can tell when an apology is authentic. If it is, they can forgive. If not, they will litigate. You can't easily cheat that with a systematic protocol. And science has not invented a device to detect authentic apology. We're headed in the same direction as the USA, where apologies are now a legal requirement. So guess what? These systematic apologies fail. Because if not heartfelt, sorry is meaningless. People can tell. So we don't need systems, we need emotionally intelligent staff and management and culture. Science has not invented a device to measure forgiveness. If managers would just fix the numbness that they've created with such a process-driven culture, and if they rebalanced priority recruitment of more compassionate, educated people instead of just highly academic people, then the need for apologies would fix itself. The NHS is crushed by rational thinking dominance and metrics. And because of that, healthcare is dominated by data collection tasks and paperwork on top of actual nursing. A powerful demotivator. Read these cuttings from 2011. Nurses left because of the gap between what they went into the service to do, care, and the stressful reality. Too few staff, too much admin, and fear of litigation. The NHS is in dire need for emotional intelligence revival alongside the metrics culture, and with that balance it could save 1.5 billion in litigation costs. The trouble is management's lack of regard for emotional intelligence in decision making. Their 5-year forward plan is 41 pages long. It fails to mention emotion or emotional intelligence anywhere. And management's long-term plan claims to have consulted all NHS stakeholders. No, they failed to consult the huge flock of staff who left early. So it fails to consider why they left the NHS. That's not in the data. The NHS never should have lost these staff in the first place. Wind the clock forward to the COVID crisis of 2020, and no wonder former staff do not want to return. One says, no, nein, niet, never, ever going back. The next says, I would rather shove a rusty 6-inch nail up my backside. Gosh. Did management try to track them down, understand them, make amends, and win them back? Nope. Instead, they resorted to propping up the NHS wholesale with overseas doctors. And this cover story of the British Medical Journal reported that trend in 1998. The NHS urgently needs to wean itself off this addiction to imported skill and have a heart-to-heart with the bounty of lost homegrown talent. The problem is rooted in rational methods, crushing emotional intelligence. And just to drive home that point, here you see that same thing in the US. A metrics-obsessed, process-driven culture has broken their staff too. Despite doctors earning $161,000, they have a 94% negative morale, 40% would not study medicine again, and nearly half tell their kids to avoid a healthcare career. Clearly, their spirit is broken, and money ain't fixing it. Public or private makes no difference. That's not the key question. So if it's not money or IT or structure, what's going to work? Find out in the next episode. We'll explore how healthcare management became so obsessed with metrics and discuss the downside of that. In the meantime, we recommend this funny book. It'll give you clues. Thank you for watching.